welcome back to another episode of Grown, Tired, and Triggered. You already know I'm your host, the one and only Jessica Nicole, and I'm coming in after turning 40 exactly 1 week ago on last Sunday. So make sure you wish me a happy belated birthday in the comments. All right, so I hope your year is starting off phenomenal. It's going the way that you want it to go, and you are working on your goals. Now, I know all of our goals probably this year was to win. Get fit, get active, get more energetic, to eat better, and those different things. And if it is, kudos, good job. But let's talk about something that's important, that's going to help us make sure we get there, we maintain there, and then we also getting our full body checked out this year. Now, let me say this up first and foremost, that this is for educational purpose only. And I have to say that because I am a licensed health insurance professional. So I am a licensed insurance professional. So I got to make sure that to let you know this is for educational purpose only. When I talk about different topics, I'm not going to be plan specific. It's just going to be general information. All right. So, and you already know January the 1st had came. The benefits have started back over. Your health insurance benefits started back over. So that means that your deductible started back over, your co-insurance, your out-of-pocket maximum, all of those things has all started back over where you have to meet those different deductibles. And before I go any further, I want you to stop and pause this video. Go and pull out your health benefits. I don't care if you have Medicaid, Medicare, employer coverage, private coverage, or whatever. This high-level overview of this information is going to help you become more comfortable with calling your plan administrator and asking them questions, or going to your human resource department and asking them questions about the plans and things that are offering at the company where you work at. And so you can be knowledgeable on how to go in, grab this information, and look and find. So right now, hit pause right now and go and get that information. Okay, you're gonna get ready. You're gonna pull up your plan information, so you can look at these words as I go. So pause. All right, so let me know in the chat if you are back and you have already grabbed your information. You knew how to log into your app that your health insurance plan is with. That you may know how to log into your employer portal. It may be easier for you to find that information. But this year, we're going to make sure that in the beginning of the year, that we are going to get our preventive services done in the beginning of the year. So if you didn't go get it done last year at all, this would be a perfect time for you to start getting those things done in the first month of the year, that January. And that way, preventive services are covered. And that way you can get all your blood work and those different things and to make sure that you are okay, tip-top shape. Because we already know that our health insurance plan, preventive care is 100% covered. This is what you know. This is what you read it on your paper. That preventive care is 100% covered, right? So you know that's 100% covered. So go and get those procedures that are in your manual that's telling you 100% covered. Go get that done. Go get your dental, your teeth checked out. Go get your cleanings, those different things. If it's covered, go get it. It's not costing you anything. So schedule that appointment and put you first. Since we are being healthy, we're taking care of ourselves. We're going to use those benefits that are in those plans that whether we have Medicaid, Medicare, or private insurance. If it's a part of that coverage, we're going to use it, and we're going to make sure that we're using those plans. So now, one of the things that some people ask me that I'm aware of is that something that sort of get us stuck and not want to go to the doctor is that sometimes we may not know which doctor to go to. Now, your plans do have in-network and out-of-network doctors. So in your health coverage, always remember, as long as you go in-network, it's the least cost effective. And if you go out of network, it does cost you more. So just be in the habit of making sure, let me see if my doctor is in network. And then whenever time that you have to go and change your plan, see if your doctor is in the network. That's going to be the most important things. And then if your doctor is not in a network, and depending on if it's an HMO plan, and that's a health maintenance organization plan, you cannot go to an out-of-network doctor. And if it don't give you access to go to an out-of-network doctor, that means that you will be covered for that full bill. And I know after being in this industry for this long, that has been a hiccup to some individuals when they receive that statement back from the doctor office or from the insurance company that they're telling them that that visit wasn't covered. Sometimes that visit isn't covered because you went to an out-of-network provider that wasn't covered, and then your evidence, your plan already lets you know that we don't cover out of network. So you got to make sure that you are checking to see whether or not your doctor is in network or out of network. And if you aren't sure, make sure that you reach out to the plan that you're with the insurance company. Call the number on the back of your card, the member service number. Call that number on the back of the card to say, well, this is the doctor who I go with. I'm not too for sure. Or you open an app. Reach out to your doctor office. Say, well, hey, do y'all take this plan? I see that you're in the network, but I just want to confirm that you are still taking whatever your plan name. Then that way, you know that they are there. So that's that they are in service for that particular thing. So that's something to be mindful of when you are using your health insurance plan in network and out of network. Are very important to know. That goes the same thing for the urgent cares, the hospital, where you're going to be receiving outpatient surgery at. But at that point, if you're going to be having outpatient surgery with your doctor and your provider knows what plan you have, they should be setting you up with the correct facility to go with based upon your plan that you have. So that's very important, and that's very important for your healthcare facility to know where you're receiving that coverage at. Another thing to be mindful of is your deductible when you are picking these plans. Now, you know, if your plan does have a deductible to meet before the plan starts paying those certain copays and co-insurance, you will have to meet that deductible. And what that basically means is that you will pay 100% of the cost for that service upfront out of pocket. So that's something to be mindful of too. So when you are selecting your health coverage for the year, that you pay attention to that deductible and be mindful that's what that deductible means. Now, some services on your plan, you may not have to meet the deductible in order to get seen. So it may have in quotation marks or whatever in there say the deductible does not apply. So if it says the deductible does not apply, that means that you will pay that copay or that co-insurance, whatever it is for that. Copays would be a set amount and co-insurance will be a percentage amount. Your plan may say that, hey, you'll be responsible for 20% co-insurance. That means you're responsible for 20% of the bill, and then the plan will cover the 80%. So that's something to be mindful of too when you are picking out your health plans, to see what do they offer. Do your plan offer a health savings account? Does it offer a health reimbursement account? So those are things also to be mindful of when you are looking at your health plan and you are planning for the year and you're going to the doctor, because you probably will be able to use your health reimbursement account and your health savings account to help cover some of that cost up front when you are going to the doctor, just depending on how your employer is loading the funds into those different accounts for you. So that's something to think about. And another thing to think about also is when you are getting yourself ready for the year. If you know last year that your doctor told you that you need to have a surgery or something, let's knock that surgery out in the beginning of the year. That way, if something else should happen and you've met that maximum out of pocket, you don't pay any more towards the services. Now, the rest of your services for the year will be 100% covered, just depending on how your plan is. But there's something to make sure of. So if you know you got to have heart surgery and those different things, schedule that for the beginning of the year. Then that way, if you have anything else going on, you've already met that deductible, or you may have met that out-of-pocket maximum, depending on how much it is on your plan. So that's something to think about. So that's why in the beginning of the year, we'll handle our businesses. And in that way, you can plan accordingly at work when you say, well, hey, I'm going to have to take off this time. Your doctor's already put your stuff in. You done put your, if you got short-term disability at work, that's good to have. If you got that time off, to put those things in place. So you can prepare. Now, if you know that's been a talk for last year or this year, this way you can start preparing and having it better prepared for. So I know myself, I've had to go through these situations too. So that's something to think about, getting it done in the beginning of the year. And I know as myself of being outside in the field and just talking to people also on the phone when I was in the insurance industry, in the call center, and just also being an independent agent, listen to individuals speak about their situations, and then them saying, well, wait, I'm gonna wait till the end of the year to get it done. Okay, but if you wait till the end of the year to get it done, if something else has to be happening in the beginning of the year, you're gonna have to start all the way back over with that deductible, that out-of-pocket maximum. But if you were to get that major surgery done in the beginning of the year, and then if something else were to go on later on in the year, you can go and get that taken care of, because it all will fall under that same out-of-pocket maximum. Your deductible been met. So therefore, that financial burden lessens. So that's something to think about when it comes to the health insurance part of life. Another thing to be mindful of also is for your medications, know how that part of your plan works, how it's going to cover your meds. Do you have to hit your deductible before your medications are covered? Will you be paying that 100% for your medications until the deductible met? Or will you automatically start paying the copay or co-insurance for your medications right out the door? Those are some very important things to pay attention to. Pay attention to also the pharmacy. Again, in-network and out-of-network. That is very important when it comes to your health insurance. In-network and out-of-network. It even goes for what pharmacy you go to, because all pharmacies will not be in the network on some plans. It all just depends on that carrier and who they're contracted with. You already know if you go out of network, it's going to be higher. If you stay in a network, it'll be less. In network equals less. Out of network equals more. Get it? So write that down. So make sure you're taking notes, and whether what I'm stating, that when you're going back through your notes or you're going back through your plan information, hold on. I remember Jessica said in network and out of network. She mentioned deductibles. She mentioned copays. She mentioned co-insurance. She told me to make sure I download the app. If you have diabetes, if you have a chronic condition, those different things. See what your plan also offers have for those, because some plans actually may have a nutrition for you, depending on what condition that you may have. Some of them even have healthy rewards when you go get your annual checkup. They give gift cards. You may get $100 just for going to go get your checkup. So those, they have different incentives also. So that's more money to help you cover some of those other costs. So in the beginning of the year, we're gonna make sure we are taking care of ourselves. We're gonna learn our health insurance coverage. We are gonna become knowledgeable because we're gonna get out the habit of saying, I don't know. No, you're gonna know because you're gonna pick up your book. You're gonna pick up that information. You're gonna download that app, and it's gonna tell you what's covered in the plan, what's not covered, how much it's going to be covered. If you may know, okay, do my doctor need to code it this way? I know I had phone calls from people say, well, my doctor said this or this, how much would this code cost? You know what, let me get you over there to the member service department. So reach out to your plan if you have those direct, specific questions. Don't be afraid to reach out to them because they're going to be the ones that answer your question the best. To help you navigate that information. So don't be afraid to do that. And don't be afraid to say, well, I see this in my book on page 34. It said that if I would go be hospitalized after 24 hours, such and such and such, I don't have to pay that $500 copay or whatever it may be. Is that correct? So those are different things. So just make sure you know where your urgent care is at that's in your network. So make sure you just go to the ones that are in network. And even if you are traveling out the country and those different things, your plan may have out of the country travel coverage. I know when I went out the country that time, I didn't my coverage didn't cover it, so I ended up getting out of traveler coverage from a different company for the days that I was out so it could cover me. But some of your employer coverages or your Medicare coverages or whatever plan that you may have that benefit. So look into the benefits. This year, I want to make sure that we are able to know what we have, to become more educated in those areas, and not to cause harm to ourselves, and to maximize what we already have, okay? And while these ways, some of these health insurance plans do have memberships included in those. So that's an expense you don't even have to, some of you don't even have to pay. You know, mail order is available on those prescriptions, things to help you better. And also when it comes to your prescription drug plans, make sure you look into see if they may have a 30-day, 60-day, 90-day discounts. And don't be afraid to switch out a pharmacy if you have to. I know I done met some people that are brand loyal and the pharmacy may be out of network and they still going to use me to move to somewhere in network. Just make sure that you are paying attention to those things. And if you have two health insurance, make sure that you're going to the doctor and you are giving them your cards so they can put them in the system. You know, one may pay for this and another may pick up the balance from the other one. So make sure that you do that. Even if you have health work insurance and Medicaid, when you go to the doctor, give them both cards. And don't be ashamed to see if you even qualify for Medicaid or if your kids qualify for CHIP. You can still, you can have those, okay? And your Medicaid may not cover a certain doctor that you really want to stay with, or you may want to go to a different doctor, have a second opinion. So you can't have both your employer coverage and Medicaid. Your employer coverage has to go first, and then your Medicaid will pick up whatever there will be left over if it were to have them. So if you qualify for these services, make sure you are signing up for those. I can't tell you how many times I have gone to someone home or talked to someone on the phone and they needed the help, but we have made a mockery over people needing assistance or needing assistance and talk about them so bad because they may have food stamps or Medicaid and those different things. And for the ones who really need it, they don't want to use it because they don't want anybody to talk about them, or they'll say somebody else needed more than me. No, these programs are made for you because based upon your income, you qualify. So it is for you. So Let's get out of a habit of that and use what's here. That's why the programs are here, because they've gotten the data. Is showing it is needed. Use it. Okay, it's there for a reason. And if nobody's not using it, that means that, hey, we need all this research, they're not using it, we're gonna do away with the program. And then other people will lose the program. So if you qualify for it, use it. It is perfectly okay. Baby, they talked about Jesus, so they're gonna talk about anybody and everybody. But use the programs. The programs are out here for a reason. WIC is out here for a reason. Don't be ashamed to use the WIC. Don't be ashamed to use your Medicaid. Don't be ashamed to use your chip. Baby, to live is expensive. It's expensive to be alive, okay? And it's more expensive, as they say, is to be not financially stable. And it doesn't matter if you're financially stable today, you can be not financially stable tomorrow. So that's where we all got to make sure that we are being mindful of everything that we're saying. So that's just one of the things I want to make sure that I just may touch briefly on the beginning of the year, is for us to make sure that we are going to get our checkups done in the beginning of the year, that we are aware and you're listening for your benefits. You're using your benefits. You're going to the doctor to get your annual physical. You're getting your vision check. You're getting your dental done. You're getting all your preventative services done. So go get checked out, especially if it's 100% already covered for you. Get it done in the beginning of the year. And if you know that you got something that's been bothering you, and you need to go to that visit, go see your primary care doctor about that. Okay, go do that visit. And then think about it. Your plan is probably already loading funds up onto a card for you already to go see the doctor, just depending on which plan that you have up front. So if you got the HSA account or the health reimbursement account, HRA account, it all just depends. So make sure you are looking at all your paperwork, reading your paperwork. And if you have questions on your paperwork, put a question mark by. Put a question and write out your question and write it on there. The same thing when you go to the doctor. If you have things that's been going on with you, write it down. Take it to the doctor and let them know. That way, things can be caught earlier and you can get it taken care of. So in the beginning of the year. Then that way you can schedule out for like the summertime. You know what, the school kids will be out in the summertime, so I probably can get this done in the summertime. So that way you can plan around it for the year, but make sure you get it done in the beginning. So that way, if something does happen, or one of the kids may get sick, and those different things, depending on how your plan is structured, they can get done what they need also, and then you have some of that relief. So just be mindful of that, and that is how that maximum out-of-pocket work in that deductible. So in-network, out-of-network, pay attention to your maximum out-of-pocket, your deductible, your copays and your co-insurance. I'm going to say those are the biggest things to look out for when you're on your health plans. See what else do they offer? Do they offer nutritions? What else do they offer? And also, if you work, see what else are they offering wellness programs that they're offering at your jobs. Now, I know I've worked on contracts with people to explain to their employees the benefits that they have. Some companies are even providing their employees with benefits to go buy fitness equipment that they can use at a home, Fitbits, walking machines, those different things, so they can remain healthy for their full wellness. Also, don't forget about the behavior health, your mental side. There is absolutely nothing wrong with going to go see a therapist. That does not mean that you are crazy or anything like that, as people want to put this thing. No, it's okay to have someone else to go talk to go vent to, that is have an oath to keep what you say confidential. The kids can use it also. So take advantage of those. If you have these programs, and especially if it's covered at 100% for you, make sure you're taking advantage of it. Don't be afraid to speak out. Don't be afraid to seek help. Don't be afraid. It is perfectly okay to use those benefits. And ask them, okay, I'm looking for a therapist. Don't forget to tell them it, all those different things. Let's just make sure that while we are out here getting ready, we are being proactively taking care of ourselves. Now, if you got any other questions or things that you want me to answer and those different things, put it in the chat. Put it in the comments. Don't forget, like, follow, and subscribe. And that's just my information that I wanted to start us out with for 2026. Us making sure we are taking care of ourselves as a whole, our body. We know how to use our benefits. So make sure you download those apps on your phone. You can't mess them up. Play around with those apps. Learn the systems. That way you are better to help you. Know what is covered. Read those codes at the back. Read those different medications. Everything you need is actually on that carrier website, who you have. So go see what's out there. All right. I hope you have a great week. We're going to enjoy 2026. Thank you for joining me in season 1. And if you haven't saw those first 6 episodes, go back and watch those. And I'll see you on the next side.